Doctors overread it. What's the most outrageous self-diagnosis that you've heard from a patient? A doctor here. I had a patient insist she had a fever once, and when I pointed out that our thermometer did not record a fever, she told me, "I'm not sure they taught you this in medical school, but when Asians get a fever their temperature doesn't go up." Yup, I missed that lecture. At the psych hospital, we had a difficult patient, violent, making wild accusations, completely psychotic. During treatment team meeting at the psych hospital, when we were working out our treatment plan, she suddenly started screaming that she'd gone blind, that she couldn't see, and if we cared anything about her we'd help her. This time, she had a point, though. The lens of her eyeglasses had fallen out and landed in the breast pocket of her shirt. Had a patient come in once due to weight gain that she thought was due to being pregnant. Made sense, except she'd taken more than half a dozen pregnancy tests and they were all negative. She was convinced she was pregnant though, and wanted me to check. I tell her okay, I'll do a blood test, since we can detect pregnancy earlier with that, and she refuses. Says that she just wants to pee on the stick in front of me and have me read it. So I say sure, and lo and behold, it's negative. Little more questioning, and it turns out she'd been eating literally nothing but chicken wings for weeks. When I asked her why in the world she would do that, she replied that she just really liked chicken wings. A reasonable response. I had a patient a few weeks ago who was in her late 80s come in worried about having a sexually transmitted disease. She goes on to tell me that she hasn't had sex since her husband died in 1994. I am an allergist. Very appropriate username. My mom took my sister and me to the doctor when we were kids because we had weird bumps all over the back of our tongues. We were diagnosed with tastibods. This is my favorite. Somewhere, I have a picture of my favorite clinic note I've ever written. For context, SOAP stands for subjective, what the patient says, objective, what I see, assessment, and plan. It goes, S, bumps on tongue, unsure of when they appeared, asymptomatic, O, tastibods, A, tastibods, P, reassure. Vet student here. I've had some dude with a super aggressive dog diagnose the poor thing with neural instability, causing his aggression, from an online consultation with a homeopathic shaman. He then came into the clinic with instructions from the shaman that he wanted the vet to carry out, including rubbing the dog all over with a $200 healing stone. Despite the fact that the vet had obviously the more reasonable explanation, he didn't want to believe leaving a dog in the backyard without much human-animal interaction for most of its life could cause aggression. Go figure. Pharmacist here. I've had more than one patient run to me screaming that they looked up their rash on WebMD and must have Stevens-Johnson syndrome. Actual diagnosis: contact dermatitis from laundry soap. For anyone reading this, do not Google image search for that syndrome. And family practice mid-level here. Had someone come in one day saying they had wires and fibers under their skin, including a little Ziploc bag of, you guessed it, wires and fibers that they had pulled out, he said, with a needle. Now, this is Morgellons, a well-known psychological entity, but to see it so blatantly like you read about in the textbooks just blew me away. He actually believed it. Very unsettling. Paramedic here. Technically not a doctor, but here goes. Walked in the door to a young male with chest pain. As I walked up to him and introduced myself, he said, "I have pericarditis." I felt like telling him, "I'm not sure how you would know if you did, but we'll run some tests and see what we have." Put an ECG on. Took him to the hospital for more tests. We found out the final diagnosis by the hospital staff was, surprise surprise, pericarditis. So there you have it, the patient was right. I still have absolutely no idea how this kid knew that. I work in physical therapy, and once had a guy with dementia say, "I know I'm in pain, but I just can't remember where." I felt bad for laughing about it later, but I had never heard something like that. Guy comes into my older one day with a nail in his hand from an accidental discharge of a nail gun. Nurses checking him in and asked him to rate his pain on a scale of 1-10. He replies that it's only about a 3. We all look at him like he's nuts because our pain is at a 5 and we're just looking at him bleeding. Plus, this is a charity hospital where 99% of the patients are sitting in bed, casually texting or chatting on the phone, but still rate their pains as 10/10. You get the picture. So, the triage nurse rolls her eyes and asks him how it could only be a 3. He responds by saying that one morning he was cooking his girlfriend breakfast. They were especially hungry that day because they had just been a bit frisky when they woke up. Since they had just finished, he wasn't wearing any pants. Well, he says that when he bumped the pan and the hot bacon grease spilled onto his testicles, that was certainly a 10/10. So, to him, a nail in the hand only rated a 3/10. There's a man who knows a 10/10. Kinda opposite to what everyone is saying, but once saw a guy with a foot that looked like death, probably untreated diabetic. He only went to the ER because his sons dragged him. He literally had his foot inside a plastic bag. Bag was tied around his ankle. Because of the smell, he insisted he was fine and to be let go. The amount of horribly sick patients that think they're just fine is too dang high. This reminds me of that one time my grandmother didn't want to cause trouble by going to the hospital when she had a freaking tachycardia. 170 plus beats minute. Psychotic patient tried to convince me he had kittens playing inside his chest. Not so much. The atrial fibrillation and palpitations were real, though. The cutest diagnosis. Seizures from a parasite. He was actually psychotic and was self-treating what he thought was a parasite infestation by drinking household cleaning agents. When he started seizing afterwards, this reconfirmed his parasite diagnosis in his mind, so he drank more. Dentist here. 27-year-old patient comes in with mother. Mother is on disability. Patient has large amounts of decay on every single tooth in his mouth. Kid absolutely will not even listen to having his teeth pulled and dentures placed. Public health office, so most are uninsured, low financial status. Really should have most if not all of them pulled. Agreed to do a mock-up treatment plan which came out to roughly $4,500. That's with a sliding fee discount of 50% for the lowest financial level. They agree to pay. Mom plunks $800 cash down for root canal to start off. I ask what happened for his teeth to get that bad. Stupidest answer I've had yet. A dentist before told me to mix dollar store mouthwash with peroxide and rinse with it. It absolutely wrecked my teeth afterwards. Mother agrees and swears that same thing happened to her husband. Older brother is getting all of his pulled. My wife is a veterinary nurse. Someone brought their dog in because of small growths and 2 lines along the dog's belly. The dog was diagnosed with nipples. Not a doctor, but work in the newborn intensive care unit. One night we were called to labor and delivery for a preterm delivery. Not a mom called 911 because her stomach hurt a lot and she thought she was dying. At the hospital it was confirmed she was pregnant and in labor. The whole time we were there she kept saying she was dying and why wouldn't we help her. OB key telling her she was in labor and to push each time she felt pain. She kept yelling, "It's just gas. I've had gas for a while, but it won't come out because I'm dying." Fast forward to baby coming out. OB hands the baby to the nurse who then shows not a mom her baby. Not a mom says, "That's not mine. I have gas." Nurse places the baby on her chest and says, "Well, here's your gas. It's a boy." This sounds like an episode from a TLC program. I no longer have cable. Patient told me she knew it wasn't a heart attack this time. It felt different than the last 19 times she came to the ER which weren't heart attacks. She was half right. It wasn't the same as the other times. She died. My elderly friend is the queen of self-diagnosis. She tells the doctors her prognosis and rarely follows through with their treatment for her actual issues. My personal favorite is that she produces too much electricity. Because of this she has issues with anything electrical, namely computers, cash registers, pin pads, and my personal favorite, gas pumps. She is afraid she will blow up the pump, so I fill her tank for her. In reality she is confused by technology and never wears her glasses. She was recently put on vitamin D pills because she rarely goes outside. Her house is basically a black box inside. I'm afraid to find her wrapped in foil one day. Not a doctor. Once had a patient come in who was convinced he had colon cancer. He was just constipated. Had an overweight young woman come in saying that she was pregnant and the baby's foot was protruding out of her vagina. We get her back quickly, start a set of vitals, and she is terribly calm about the whole thing. Ended up she was not pregnant at all, just crazy. An older gentleman came in complaining of headaches. During his history, he became agitated and kept insisting that the government had been experimenting on him by dusting his house, food, water, etc. with anthrax. He was quite certain that there was anthrax in his brain because he could see it in the back of his throat. Turns out he just had an upper respiratory infection. So, same thing I guess. Posted earlier things my patients as a paramedic told me, but this one is mine, albeit in reverse. Finally went to urgent care one night after several days of severe abdominal pain. Doctor insisted that it was appendicitis, despite my insistence that I do not, in fact, have an appendix. He was thoroughly confused when he couldn't find the appendix with the ultrasound. Cue looking for my gallbladder, thinking gallstones, swing and a miss. I'm missing my appendix because they took it out along with my gallbladder at 5yo due to gallstones. I went to the doctor once with stomach pain, and the doctor thought I had appendicitis and sent me to the ER. Turned out I was massively constipated. Medical diagnosis: I was full of crap. Not a doctor, but I was in the ER in college in New York City for some crazy stress. I think I was over caffeinated and had not slept in 2 days from studying. But anyway, I ended up just being dehydrated and they gave me an IV and let me hang out there for a while. In the background I kept hearing this guy yelling, "I'm gonna faint. I'm gonna faint," and it seems pretty legit. So I was getting worried. Finally, he yells it out one more time, and a doctor walks by and says, "Mister, you're in a hospital bed, so if you faint, I think you'll be okay." I once had a girl who said she had syphilis because she got like this ulcers in her mouth, which were coming and going, and she said she had zits on the back of her tongue. I looked and it was her taste buds, no other lesions to be seen. I told her that primary lesions in syphilis almost always cure completely, so if those ulcers were appearing and disappearing every once in a while it was very unlikely. By that point she had gotten a lot more relaxed and the consult went great and she went home feeling a lot better. Still, I made her get an STD panel because she was sexually active, young and in doubt of her partner. Next consult she shows up saying, "Doc, I think I do have syphilis." She did. I learned a valuable lesson that day. Cool thing was she wanted to do her treatment and follow up with me because she told me she had seen a lot of people before me but no one bothered to check. As a resident I had one patient wait in the waiting room for 8 hours for painful lips. Diagnosis: chapped lips. Prescribed chapstick. Another patient waited the same amount of time in the ED waiting room at the County Heckhole Hospital. The reason? Mosquito bite. One stupid mosquito bite. He said he was a hemophiliac and was afraid he would bleed to death. Dentist here. I had a patient come into my office, absolutely certain he only had gingivitis and needed a normal cleaning. All because he had googled his symptoms and believed he could get a normal clean and go back home and do oil pulling after, which would somehow miraculously heal his gums. Would not allow me to take X-rays or deep clean his teeth, which he needed because plaque was formed well below his gums. He even told me his gums were bleeding from just smiling, moving his mouth, etc. He insisted on just a regular clean and then accused me of trying to make money off him when I basically put my foot down and said I wouldn't be working on his mouth unless he allowed me to do my job properly. I was glad when he decided to walk out and never come back. I once had a middle school band student who had to miss a rehearsal because she had bruises all over her legs. The doctor's diagnosis: unwashed blue jeans. I had a woman once that was convinced that someone was trying to steal her Klonopin, so she ate all 45 of them. We try to get her to drink AC so that we hopefully don't have to lavage them out. She fought us over that because now we were the ones who were trying to steal them from her. That was on a rotation in paramedic school. Another was the woman who swore she was having a heart attack, despite not having any symptoms at all. We did the EKG and full workup, which unsurprisingly came out completely normal. She insisted, so we transported her anyways. I apparently ran all their tests and discharged her when they were clear. 3 hours later, guess who calls? She's still convinced she's having an MI and wants to be transported to another hospital. She was politely told to frick off. Found out later that she calls once a week or so. Unrelated but funny was the old man who called us out because he couldn't find the TV remote and his son was asleep. You have been visited by the distinguished doggo of delicious delicacies. Comment tasty supper, pupper, and be blessed with delectable dishes for the next decade. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day, you magnificent people.